Well, it's the stuff of books and Hollywood movies, but now scientists in the US have unlocked the secrets of eternal youth during tests on mice. Now, hoping to find an elixir which would delay or even stop ageing. They've discovered one which reverses the process.
Within 2 months of receiving treatment, the elderly mice were completely rejuvenated. Even their mental abilities bounced back. So did their sex lives. They went out like rabbits, apparently. So have experts finally turned the myth into reality? Well, here to tell us whether that's possible is GP Dr. Cindy Pan, who's actually 110. Explain to us how this elixir works, please.
Well, it's thought to work by basically switching back on a particular enzyme called telomerase. Now, telomeres are these things on the ends of chromosomes. So in every cell of your body, you've got genes and they're held on the chromosomes. And these are capped by these telomeres, which are thought of as biological clocks, because as you age, they tend to shorten and fray, and then you get cell damage and eventually cell death. And normally this enzyme gets switched off, but this drug is thought to switch it back on, or basically shock it back into action, so you can rebuild and repair these telomeres. And in the case of the mice anyway, they found that their organs, which apparently had started to resemble like 80-year-old organs, after 2 months they actually were rejuvenated and they'd grown all these new cells.
Wow.
Yeah, and it was not, so it's not just simply the appearance of youth, it's actually affecting the organs and the organ systems, or at least those of the mice. So
right.
Yeah, okay, so that's the effect on the organs. What are the health benefits?
Well, I guess, you know, by reversing cell damage and preventing this kind of deterioration and damage to the cells, presumably it could either stop or slow down all these typically age-related conditions like cardiovascular disease, Alzheimer's and other mental problems, diabetes, all those sorts of things that come with age, and presumably as well things like arthritis and all the other typical wear and tear type things. And I mean, it's just fascinating that these mice, these male mice who are infertile, were suddenly fathering these big litters of baby mice.
Yeah.
It's just, it's something that I think surprised the scientists, because I think that organ damage was thought to be relatively irreversible, but the fact that not only the drug slowed down the ageing process, it actually reversed it. It's quite fascinating. But whether or not that will translate to being effective with humans, that's a
well, that's
big
the question, isn't it? That's the question.
Well, they say that it'll be at least 10 years before they can start trials in humans, and there are obviously potential adverse effects and downsides. Like, for example, this enzyme telomerase, it's believed that having high levels of telomerase could also actually promote the growth of cancers. So, you know, it's going to be a long time before it'll be available in the pharmacies. But it's just a real breakthrough in research, this concept that you may be able to reverse damage, that you can switch this telomerase back on and actually repair telomeres. So basically turning back the biological clock, that concept at least has been broached and to some degree breached.
Right. What about if you had a disease? Does this still work? Say if the mouse had cancer, does this work for diseases or not? Or just...
I don't get the impression that it will necessarily reverse cancerous growth, but certainly in the case of these mice, the organs were rejuvenated, they were able to generate new cells. I think the issue with cancer is, part of the problem with cancer is you're generating too many new cells, and they are mutant cells. Yeah. So this is working on the level of the chromosomes and the genes.
Right. Okay.
Yeah. So whether or not it will help with cancer, that's an issue, and in fact it's potentially going to potentiate cancer. So that's a risk.
So 10 years before it gets out of the rat cage and onto humans, and then another 10 or 20 years after that, maybe? Yeah. Like, how long do I have to wait for this stuff?
Yeah, who knows?
Because...
I mean, maybe this doctor will start taking himself and be crawling around the lab like a baby.
Yeah, right. Right. All right, Cindy, thank you very much.
Thanks, Cindy.
Good to see you.